Oklahoma Voice with Jonathan Clour on KTLV 1220. Good evening, everyone, and welcome to Oklahoma Voice. I'm Jonathan Clour. Tonight, we have another special guest on the program, Dr. Ervin Yen. He is the newly elected state senator of District 40 in Oklahoma County. He is on the program to introduce himself and to tell us a little about his background and to fill us in on what's happening on the Senate floor. But before we get to Senator Yen, I want to remind you that Thursday night we will have Representative Paul Wesselhoff on the program. He is retiring and term limiting out of the Oklahoma House of Representatives. Representative Wesselhoff will talk a little about his tenure in the Oklahoma government, as well as his legislative duties in the Potawatomi Nation. Also, later this week, we will have the guys on from ThunderOpEd.com to give us our weekly Thunder basketball report and the latest Oklahoma sports update. Now I'd like to welcome Oklahoma State Senator Dr. Ervin Yen to the program. Senator Yen, welcome to Oklahoma Voice.
Thank you so much. Pleasure to be here.
Senator Yen, when were you elected to the legislature?
The general election was November of last year, so I am a newbie.
Yeah. Tell us a little bit about your district.
Well, it's northwest Oklahoma City. And the northern border is pretty much Britton Road. The southern is 23rd Street. To the west, it's MacArthur. And to the east, it is Western. And although down south, it's Classen Boulevard. But that is literally where I have lived for 45 years. That's where I grew up. I mean, literally 3 homes over my lifetime are all in that district. And 3 of my 4 public schools are in that district. And the 4th school I went to is very, very close to the district. And then 3 churches I've gone to over my lifetime are all in Senate District 40.
Wow, that is your stomping grounds.
Yeah, that's one of the reasons I decided to run. I just thought that would help get me elected.
Well, what inspired you to run for office?
Well, I'll tell you that I'm not one of those persons who's dreamed his whole life about entering politics. It's the furthest thing from my mind. But what really happened was, for the last 10 years or so, I've gotten pretty active politically, primarily going to the state capitol and to D.C. to lobby folks on issues that affect anesthesiologists. I'm an anesthesiologist, and I've been a board member of our state society of anesthesiologists. And so I've met a lot of legislators, both here and in D.C., and I've decided that the vast majority of them, and maybe not all, but I think the vast majority of our legislators are good people who are trying to do the right thing. But as you know, our legislature deals with everything, and these legislators can't possibly know everything about everything. And they certainly don't know health care like I do. And believe it or not, we have not had a doctor in the state Senate for, the last time was 41 years ago. And
really?
In fact, yeah, and that was a guy named Dick Stansbury, and he was actually the senator for District 40, my district, although the borders back then were a bit different. But so, yeah, I just wanted to be there to help educate the other senators when it came to healthcare issues. And, of course, we've got some major healthcare reforms that are going on, both at a federal and a state level. And I just wanted to be a part of that conversation so that I could tell the other guys that, look, if you pass this bill that deals with healthcare, this is what I think will happen. These are the ramifications. Because, frequently our legislature passes bills and they really don't know the ramifications until they pass it and it goes into law, and then they go, oh, my God, it does this. And so I just wanted to be there to help let them know what I thought as a doctor.
Well, are you on the committees to help you engage the legislature and to engage the folks outside the legislature to coordinate good legislation?
Yeah, yes, I'm the vice chair of the health committee.
Okay.
So, yeah.
Right.
And I was quite honored that the Republican caucus made me the vice chair. I was very lucky with I
Wow.
did that.
Well, congratulations on that. And you're discussing healthcare. What are some of the biggest issues that Oklahoma is facing in the medical field with healthcare, or perhaps you could even bring that to the national level as well?
Well, during my campaign a year and a half ago, when I was working real hard at it, the Affordable Care Act was on everybody's minds. And during my campaign was when we had the disastrous rollout of the Affordable Care Act. And so that made everybody want to talk about it. And also during my campaign was when Senator Coburn announced he was going to quit the U.S. Senate. So really, that I think those two things helped me get elected because it put healthcare on everybody's mind. But here's what I say about the Affordable Care Act. I certainly know some folks that have gotten insurance coverage through the Affordable Care Act that didn't have it before. And our president, of course, told us all that pre-existing diseases would be covered, which most people would agree that's a good thing. And then also children would be covered until they're 26 years old, and I think most people would agree that's a good thing. But he also said, and it'll be cheaper. And anybody that believed that, I certainly didn't believe that, but anybody that heard him say that would go, really? How's that going to work? And here's what I can tell you from my personal experience. I have had health insurance through the State Medical Association, okay? And it's pretty much it is a nonprofit entity. What I have paid for over 30 years in premiums goes to pay claims except for the administrative costs. And I think I've been told that the administrative costs in our health insurance plan is about 11%, which I guess that's okay. It's not great, but it's not terrible. But anyway, so it's sort of a nonprofit. Well, my health insurance premiums over these 30 plus years has gone up occasionally, 3, 4, 5, maybe even 7, 8%. Okay, rarely. Usually it's gone up each year, maybe 2, 3, 4%. Well, the year that the Affordable Care Act came on board, my premiums went up 9%. Okay, all right, and I'm not complaining. If someone said, pre-existing diseases are covered, kids are covered till they're 26, if that costs 9%, that's not too bad a deal, and I would agree with that. However, 1 year before, in anticipation of the Affordable Care Act, my premiums already went up 27%. Okay?
Wow.
So 27% that year, then the 9% when the Affordable Care Act, when it came on board, and then a year later, this year, another 14%.
That's staggering.
Right. So anyway, my point is, there's certainly some good things about the Affordable Care Act, but it is not affordable. Not affordable.
With the Obamacare, one of the largest concerns was that it was going to be putting doctors out of business. Is that true?
Well, not that I've seen. Okay, I can't say that has happened. But I will tell you that I've talked to a significant number of people who have tried to get health insurance through the federal website, and a lot of them made too much money, so they didn't qualify, or some qualified, but the premiums were too high. And I've talked to a lot of primary care doctors who tell me that they have patients who January 1st of the year that the Affordable Care Act started, they went to Walgreens to get a prescription that they've been getting for years, and all of a sudden it's way more expensive. And I think I surmise that probably happened because the deductibles for these new, quote, better plans was real high. And so that's why. And of course, our federal government was really counting on younger, healthier people to help subsidize those sicker people. Well, that hadn't happened because these younger people, they say, gosh, I'm young, I'm healthy, I'm bulletproof. What do I need health insurance for? I'll just pay the penalty. So that was a huge mistake. Now, as far as overall health care in Oklahoma, nationwide, we've really done a pretty good job of decreasing smoking rates. We could certainly do better, though, certainly. But so that's a plus. However, in Oklahoma, our problem is obesity, of course, and as I'm sure we're one of the most obese states in the country. I think Mississippi beats us out, and maybe there's one or two others, but we have way too much obesity in Oklahoma, and sometimes when I travel out of state, I notice that as I get, when I fly home, the closer I get to Oklahoma, it just seems like people get more and more obese, and we've got to do something about that. I mean, we have to. And interestingly, I think at least in Oklahoma City, we're doing a little bit better. And is that due to Mayor Cornett? I don't know. Maybe. We've put in these walking paths, like along Portland, south of Lake Hefner, which is my old neighborhood. And I remember when they put those in, I sort of thought, I bet those sidewalks are real expensive. I just wonder if people are really going to use them. Well, by golly, they do. They do. I drive by there all the time, going to Baptist Hospital from my house, and there's people walking their dogs, there's joggers, there's bikers. People are really using that stuff. And interestingly, I think it's about 10 years ago, Men's Fitness magazine rated Oklahoma City as the 8th fattest city.
Wow.
In America.
Gosh.
Yeah.
Wow.
However, about 2 years ago, they said Oklahoma City was the 23rd fittest. So we are doing better. We've got a long ways to go, but we are doing better. And I don't know if you ever noticed, sometimes I drive home through, there's a park kind of north of 63rd Street and Grand Boulevard. And I think it's Thursday nights. There's people in a running club that run through there, and of course in the wintertime it's like dark when they're out there running.
Sure.
A lot of them have headlamps on, thankfully, but they're everywhere. I go, oh my gosh, I hope I don't run into one of these people. It's kind of hard to see. But so anyway, it's exciting what's happening, and of course diabetes in the state. We have a lot of diabetes, and especially in our American Indian population, as a matter of fact. But I take care of, I'm an anesthesiologist, and I take care of people for cardiac surgery most of the time. And gosh, almost all of those patients have high blood pressure, are obese, have diabetes, and if they're not smoking, they at least have a past history of smoking. And so, the obesity and smoking are two things that we can absolutely do something about. So
exactly.
We got to work on that. And of course, as everyone knows, preventive health is way cheaper than treating diseases after they occur. And that sort of segues into legislation I'm working on. I'm working on legislation to increase the percentage of children that are vaccinated in Oklahoma, because our vaccination rates currently in Oklahoma public schools is actually, say for MMR, which is measles, mumps, rubella, it's about 90%, 90%. And all the experts and scientists will tell you that you really need 93, 94, 95%. So we have too many children that are not getting vaccinated. And vaccination that's preventive health. It saves money. And it just floors me that we've had a case of measles in Oklahoma.
Right.
And I think just one. The chart I saw said Oklahoma had between 1 and 4, but I think it's just one. And I think it might have even been from the Disneyland outbreak. But also, lesser known, is that we have had a 50-day-old infant in Elk City die recently from whooping cough, also known as pertussis. And that's a perfect example of why you need kids vaccinated, because when you're 50 days old, you're too young to be vaccinated for whooping cough. Your immune system is not really developed well enough to be immunized or to be vaccinated for whooping cough. So the first shots, actually you get several shots, I think maybe 4 by the time you're 12, but the first whooping cough vaccination shot is not until 2 months old. And so when a newborn is younger than 2 months old, they cannot be exposed to whooping cough. If they are, the chance of getting it is very, very high because it's very, very contagious. And here's the problem in newborn infants. If you or I get whooping cough and our windpipe swells by, say, 1 millimeter, that's no big deal because the opening of our windpipes, of an adult windpipe, is about the size of our little finger. Okay? In a newborn, the problem is their windpipe is about the size of a small straw. And if that windpipe swells by 1 millimeter, it can be problematic for the baby. And if it swells by 2 millimeters, they can absolutely die.
Oh, wow.
So, yeah, that's why it's so important to be vaccinated for whooping cough. You don't want newborn babies around anyone, including grandparents who might have whooping cough. They might just think they have a cold. And interestingly, I didn't know this till recently, but adults should get the whooping cough vaccination at least once while they're an adult. And actually, there's something called the Tdap, which is tetanus, diphtheria, and pertussis, or whooping cough. And adults are supposed to get that.
Wow, I see. Now, these vaccinations, are they mandated?
Well, currently, our state statute says that you do not have to vaccinate your children unless you want to send them to school.
Right.
Okay. If you want to send them to school, there are 11 vaccinations that they need to have, although some of them are combo vaccinations. Now, however, you can be exempted from those 11, any of those 11, if you have a medical reason, like you're allergic to something that's in the vaccination. Okay? And these 11 vaccinations are ones that have been around for a long time. Okay? These are not new vaccinations, like they're not shingles, they're not meningitis, they're not the HPV, which is the sexually transmitted thing. These are ones that have been around a long time. Okay, so you can be exempted from a vaccination if you have a medical reason. Okay. Now, also in statute, it says that you can be exempted for a personal reason or a religious reason. Now, other states call it a philosophical instead of personal, but in Oklahoma we refer to it as a personal. And for the personal or religious exemption, the parents just have to sign this form. Okay. Now, for the medical exemption, you have to get a doctor's signature. Okay. Now, I have a doctor buddy whose wife is a school nurse in the Putnam City School District, and she believes there's a significant number of parents who will sign for that personal exemption because that's easier than getting their children vaccinated. It's just easier. It takes less time. Just sign this little form. And that is just wrong.
But that would have some scary ramifications to that then. If these folks keep signing it off and that becomes a popular choice.
Right, exactly. And I guarantee you that since our measles, mumps, rubella vaccination rate in Oklahoma in kindergartners is 90%, I think it's just a matter of time before we have an outbreak of, say, measles, mumps, or rubella. And,
really?
A lot of people say, well, nobody's ever died of measles. In fact, I had I had a chiropractor the other day say that to me. And that is wrong, okay? The measles vaccination came about I think it was about 1963. And prior to that, every year in America, 400 to 500 people died from measles.
Wow.
Okay?
Yeah.
And people, since we've gotten rid of measles, in fact, it was declared eradicated back in about, 2000, I think it was. But it is back. It is back. And people, and part of the reason is people have forgotten about measles. They're like, I'm not going to get measles. It doesn't kill anybody. But like I said, 400 to 500 people every year died from measles. And even if you don't die, it can cause inflammation of your brain. And I don't know about you, Jonathan, but I don't think I want inflammation in my brain.
No.
And interestingly, I wish this had been more publicized, but last year in 2014, there was a measles outbreak in an Amish community in Ohio, and 386 people got measles. And I don't think anyone died, but 8 people were hospitalized. Okay, now, I guarantee you, vaccinating 386 people is cheaper than putting 8 people in the hospital.
Right.
Yeah, and I think maybe even when they publicize that story a little bit, a lot of Americans sort of say, well, I'm not Amish. What do I need to worry about?
Sure.
But I think the Disneyland outbreak kind of went, most folks in America kind of went, well, Disneyland, that's someplace I've been to. And
sure.
So I'm hopeful that that's helped put immunization on people's radar and how important it is and how it saves lives. I don't care what you say. Yes, you can get a disease even though you've been vaccinated. Okay?
Sure.
Yes, but the chance of that happening is not very high. And if you look at history, there's no question that the higher the percentage of your population that is vaccinated for these highly contagious diseases, the lower the incidence of the diseases. I mean, that's exactly why we got rid of smallpox and we got rid of polio. And we actually nearly got rid of whooping cough. In fact, it's in 1922. In America, there were like 107,000 cases of whooping cough. Okay, that's 1922. Okay, fast forward to 1976, there were only a little over 1,000. Okay, 1976. But 3 years ago, in 2012, we had almost 50,000 cases. Okay, that should not be happening.
Yeah.
And why has that happened? It's multifactorial, like everything else. But I think the number one factor is that more people are not getting vaccinated.
Mm-hmm.
Yeah, it's quite clear to me.
And it as you said before, it all lies in preventative care, and it looks like it's all about educating our people on this.
Right.
How can we better educate our folks and our future generations on this, on the importance of immunizations?
Well, part of it is being on the radio like we are right now.
Okay.
And you can certainly have a serious reaction to a vaccination. Okay, the scientists will say, yes, you can. The doctors will say, yes, you can. Okay, that does happen. But thankfully, it's quite rare. In fact, the CDC and the scientists and the pediatricians will tell you that the chance of having a serious reaction to the vaccination is actually less than 1 in a million. Okay, 1 in a million. Now, the chance of being struck by lightning over your lifetime is 1 in 165,000. So that's 6 times more likely.
Yeah, that puts it in perspective.
And the chance of dying in a plane crash over your lifetime, 1 in 8,000. Okay? And usually that's a small plane. Commercial planes are much safer. Now, but this is the kicker. What's the chance of you dying over your lifetime in a motor vehicle accident? 1 in 118.
Well.
Okay, so yes, there can be serious consequences to a vaccination. Okay, but thankfully it's quite rare, and I myself wouldn't worry about it. I'm vaccinated. My kids are vaccinated. I recently got that shot I was talking about earlier, the DTaP. Okay,
sure.
Because I was going to go out of the country, and I knew I hadn't had my tetanus shot in at least 10 years. And I will tell you that I got that in my left arm, and for the next 10 days, maybe 2 weeks, both my arms were sore and my neck was sore. Now, it wasn't horrible. It wasn't horrible, but it was noticeable. So, yeah, you can have some side effects, but the benefits far outweigh the risks. Virtually all the scientists and all of the doctors will tell you that. And there's no association of autism with vaccinations. There's no association of autism with thimerosal, which is a preservative made from mercury that actually used to be in vaccinations. It's no longer in the vaccinations that children get now. It may still be in some other vaccinations. thimerosal has been in a lot of things as a preservative. I mean, it kills things. That's why it's there as a preservative. And it used to be, I wear contacts. It was in my contact lens solution. They took it out, but I don't think it hurt me. Yeah, I mean,
Sure.
It's like bleach. I mean, bleach is a toxin, but we use it all the time for various things. And you certainly wouldn't want to drink a bottle of bleach, and you certainly wouldn't want to drink a bottle of thimerosal. But having a little bit of it is something to keep bugs from growing in it. It's probably not a bad deal.
Right. Right.
No autism. Most recently I heard someone say, well, these vaccinations cause peanut allergies. I'm going, peanut allergies? Where does that come from? And I'm going,
interesting.
Actually, as a physician, I think I know what causes peanut allergies, and that is, in some people, we don't know why, eating peanuts causes peanut allergies. Because that's the way allergies are. You might, like I've had patients who have been given an antibiotic, vancomycin, a pretty strong antibiotic, and the first time you get it, probably won't do anything. But rarely a person, after getting it once, gets sensitized. And the second time you give them this vancomycin, they can have a major reaction and perhaps even die. In fact, I've seen 3 patients that got vancomycin that thankfully they did not die, but it hurt them for a little bit until we were able to fix them. Yeah, so.
I see. Well, you've really brought all this into perspective, and I appreciate you fleshing this out, because I do agree. Our folks need to be educated, and they need to learn to not be scared of this.
Absolutely.
And when you're in the hands of a professional like yourself that has devoted their life to medical study, it becomes quite clear that it is not something to run away from, but to go to for preventative care.
Yeah, and I am not a legislator that's for big government. Okay, absolutely not. I'm conservative, and I don't want big government. But my bill would take away the personal exemption, and it would save lives. I guarantee you. And it's about public safety. The anti-vaccination people talk about parental rights, and I say, well, what about the rights of those parents that have a immune compromised child that can't be vaccinated? What about the right for them to send their child to school and not be exposed to a highly contagious disease that could literally kill them?
Right.
Yeah. And a lot of people don't realize how contagious some of these diseases are. Measles. If I were to expose you to measles and you were not vaccinated, you have a 90% chance of getting it. 90%. If you're vaccinated, yes, you can still get measles, but the chance is only 1%. 1%. And measles is one of those diseases. In fact, there's a great Nova episode talking about vaccinations, and they talk about how there was a measles outbreak, and it was they traced it to people getting it from a person who had measles who pushed a button on the elevator. And then somebody came behind later, pushed the button, and got measles that way.
Interesting.
It's so contagious.
Interesting. Well, I want to remind folks that we are visiting with Dr. Ervin Yen. He is the newly elected state senator of District 40 in Oklahoma County. And Senator Yen, we're going to take a hard break real quick, and I want to remind all of our listeners on how to tune in to our programming. And you can tune in using our TuneIn Radio app. If you don't have it already downloaded to your phone, I want to remind you that it is free. Simply go to your App Store selection on your phone, tablet, computer, or smart device and enter TuneIn Radio into the selection bar, then click download. After you have it installed on your device, open the app, find the search bar at the top of your screen and enter KTLV. You'll find it at the top of your list. Select KTLV and then push play. It's that easy. Or we have another option to gain access to Oklahoma Voice, and that is by live streaming at KTLV.com. We've also created a channel on YouTube where you can rewatch any shows you might have missed, and that is at Oklahoma Voice with Jonathan Clour. These are all recorded by webcam and downloaded the evening of the show. We are live on the air with Senator Ervin Yen. And he has been educating us on immunizations. He's been educating us on some of his legislation that he is going to try to get implemented in our legislature. Senator Yen, you were talking about your bill. Is this going to be an uphill battle to get this bill passed?
Oh, yes, absolutely it will. Because, the Republicans, I would say, most of the Senate is Republicans now, but about half of them are these very, very conservative folks that don't want the government telling us what to do.
Sure.
And I totally agree with them, but not when people are literally dying. And interestingly, this past session back in the spring, I had a bill that dealt with texting while driving. Okay.
Uh-huh.
And a lot of my Senate colleagues were against that as well. Okay. And so
Sure.
what actually happened was, and I don't know if you recall, but our governor in her State of the State address actually mentioned the need for a texting while driving bill. And I think that was after the two state troopers were hit by the guy who was updating his social media page. Okay, so I think that's, unfortunately, that certainly helped put texting while driving on everybody's radar. And what happened in the legislature was there was a couple of bills that made it illegal to text while driving, but it was a secondary offense. Okay?
I see.
And in my opinion, making it a secondary offense was basically, which means you cannot be given a citation unless you're doing something else illegal. And in my opinion, what that did was really nothing. And so one of those bills I tried to amend to make it a primary offense, meaning you can be ticketed for texting while driving, and I failed. Okay, my amendment actually failed. But I learned a lot as a newbie legislator. Sure. I've got a lot to learn. Anyway, it failed, and I learned some things from it. And it turns out that bill didn't go anywhere. So then another bill comes along, and I said, I'm gonna amend this one to make it a primary offense. And I was told by a lot of senators, no, don't do that. You'll kill the bill, or your amendment's just gonna fail again like it failed before. Well, I worked real hard on that amendment, real hard. I literally walked all over the Senate and spoke one-on-one with those senators that I thought might vote against my amendment.
Right.
And lo and behold, that amendment did pass, and the bill passed with my amendment. And so November 1st of this year, it became illegal to text while you drive, and I'm very proud I had a hand in making that happen. I actually had my own bill that made it a primary offense and had a $250 fine, but that went nowhere. Actually, our caucus sort of wasn't too interested in my bill when I brought it up over a year ago. But thankfully, I was able to amend this other bill, and we got that passed. It was hard work. It was hard work, sure. But it was definitely a learning experience for me and helped me in learning about legislating.
Mm-hmm. Are there any other bills that you're excited about, perhaps maybe outside of healthcare or?
Well, I can't say I'm excited about this, but probably really our major issue is the budget, as everyone knows.
Definitely, and I'm glad you brought that up, Senator Yen. I'm glad you brought that up.
And I'm a newbie, so I tell you what, this budget process is so complex, and there's monies that come from all different places. There's federal monies that come. There's matching funds, and so it's unbelievably complex. But most people believe that we're going to have perhaps a $1 billion shortfall.
Wow.
Okay, because the oil and gas industry is certainly hurting in the state right now. And someone told me this that I didn't really realize. The problem with oil and gas is the average oil and gas job in Oklahoma pays about double what the average Oklahoma job pays. Okay, so we've lost a significant number of those jobs and the state income tax from those jobs.
Mm-hmm.
So that's a huge problem for this state.
Right.
Now, most people that in the energy business have told me that they think the price of oil will go up, start creeping back up, perhaps the middle of next year, which will certainly be good for Oklahoma.
Mm-hmm.
But as far as the budget goes, here's what I say, okay? The Republicans, and I'm a Republican, have for years talked about how, we're for less government, we're for, less taxes. But have we really cut our state budget? And of course, we haven't cut our federal budget, that's for sure. But I think this is our chance to make some substantial cuts in what the state of Oklahoma spends. And I think the voters will understand if we do that, when we're looking at a $1 billion shortfall. This is our chance to do something that we should have done years ago. Well, let's get it done. Let's get it done.
There's a lot of folks that say that Oklahoma somewhat puts all of its eggs in one basket, and that is in the oil industry. We see that oil plays a crucial role in Oklahoma and keeping folks employed, and it's one of the largest money generating workforces out there. Have we put all of our eggs into one basket, and then when the oil drops, people lose their jobs, and we wind up in a state that's not so good? What are your thoughts on that?
Oh, well, yes, we have. However, I think Oklahoma has diversified a bit because what we're up against right now is not nearly as bad as what happened with oil and gas back in the 80s. And I think that's because Oklahoma has diversified some. And, we're trying to get into aerospace, which is great. Of course, we got a lot of wheat in the state that we sell. And I think thankfully, our 5-6 year drought ended this spring in a big way, of course.
Sure.
So I think our wheat output is drastically increased. And, perhaps we could sell that wheat to folks in other countries. But I'm excited for Oklahoma and Oklahoma City, There's no question Oklahoma City, which is where I've lived since I was 4 years old, is up and coming. I mean, for years I've told people that, Oklahoma is a great place to live. It's a great place to raise a family, but perhaps it's not the most exciting place to visit. But by golly, we are getting better. We absolutely are getting better.
Mm-hmm.
And, we're lucky to have, like Boeing around, and American Airlines in Tulsa. And so I think we have diversified a little bit. And I tell you, this year is real exciting because, there's a possibility we could get a, NBA championship,
Right.
Maybe.
Right. And we're going to keep our fingers crossed.
NCAA football championship.
There you go.
Yeah.
Now you're talking.
Yeah, okay.
Now you're talking.
I had OU student football tickets for literally 12 years because of undergrad, med school, and residency. And so, I'm
dedicated fan.
Yeah, I'm pretty hyped up about this.
Yes.
It could be a lot of fun.
Yeah, that's a fresh vibe here in Oklahoma, especially right here in Oklahoma City. And I'm glad you share that enthusiasm.
Oh yeah. Unfortunately, Baker Mayfield, I guess, will not get the Heisman. But here's what I say: if he'd gotten the Heisman, then we probably would definitely lose and not go to the national championship or lose the national championship. But now that he's not getting it, I think that helps us. He's going to prove himself, and maybe we'll win that national championship again.
Well, I hadn't even thought of that. And I think our sports, our local sports, is really important. And once a week we do our weekly sports update with a couple of sports contributors, and so I mean that's extremely important. We here in Oklahoma, we like our sports.
Yeah, and somebody told me about the economic impact of having the Thunder here, and someone told me that
it's been tremendous.
Per game, it's like several millions of dollars.
Oh, yeah.
That's just pretty cool.
It's mind-blowing.
Yeah, and I tell you what I certainly notice is we've just got new restaurants in this city. Just they're popping up everywhere.
They are.
They're wonderful.
And they're classy. They're classy.
Absolutely.
They're places you want to go.
Yeah, and now I will say that it seems like most of them are seem too expensive to me, but I'm sort of a cheapskate. I had 5 children, and so I have to watch my pennies. I really do. It's 5 children, and of course 5 colleges to pay for. So,
well, we like to hear that coming from our legislators that they watch those pennies.
Right, exactly.
That's excellent.
That's definitely what Oklahoma needs to do. That's
most definitely. Well, Senator Yen, we are just running out of time, and I wanted to talk about your background. And you had actually immigrated to America with your family from Taiwan, and you had been naturalized as a citizen at the age of 9 years old. And we didn't get a chance to talk about it, but would you please come back on the program so that we could talk more about your background and perhaps more about your legislation?
You betcha. Absolutely. I'd love to do that. My parents were born on the China mainland, and basically they moved to Taiwan. It's a long story, but we'll get into that later.
Yeah.
But we basically came to America because my parents were fearful the communists would come take over Taiwan.
Well, that is, I mean, I'm really wanting our listeners to hear this story because, I mean, you truly have an inspiring background that we as Americans need to hear.
Yeah.
So maybe I'll give your office a shout, shortly, and I'd love for you to come back on and we can talk a little bit more about your legislation too.
You betcha. It's been fun, and I look forward to doing it again.
All right, Dr. Ervin Yen, everyone, we appreciate you, and thanks for joining us in Oklahoma Voice.
Thank you, Jonathan.
Bye-bye. Well, folks, I want to remind you again that Thursday night we will have Representative Paul Wesselhoff on the program. He is retiring and term limiting out of the Oklahoma House of Representatives, and he will come on to talk about his tenure in the Oklahoma government, as well as his legislative duties in the Potawatomi Nation. Also later this week, as I mentioned earlier on this program, we will have the guys from ThunderOpEd.com coming to give us our weekly Thunder basketball report and the latest Oklahoma sports update. Folks, it has been a pleasure, and you have been listening to Oklahoma Voice. I'm Jonathan Clour. Good night, and thanks for listening. This has been Oklahoma Voice with Jonathan Clour. Tune in Monday through Friday night at 7 p.m. on the TuneIn Radio app, by live streaming at KTLV.com, or by radio on station 1220 AM.
KTLV AM 1220 concludes its broadcast day. For information on programming, operations, and sales, please check out our website at KTLV.com. This is KTLV, Midwest City, Oklahoma City.